This is Rhea Gambrell, and if my phone will check in here, the time is 10:45 p.m. on March the 29th. My video is due by midnight and it will not upload, as I have let you instructors know. So I'm hoping that this will be sufficient. I'll post it to YouTube hopefully afterwards. Here we go. If it will start. Oh, come on. Go.
Hello, Veronica. My name is Rhea. I'm a nurse practitioner student with the University of North Texas, and I'll be doing your physical assessment today. Just give me a second to wash up and we'll get going. Okay, just to kind of give us an idea of kind of your level of consciousness and alertness, can you tell me what your name is?
Veronica Hart.
And what is the date today?
March 29th.
Approximately what time is it?
Oh, about 11:30.
Okay. And what do you do for a living?
I'm an RN.
Okay. Veronica is dressed appropriately. She is alert and oriented. Her conversation is clear and easy to understand. And her affect is congruent. How have you generally been feeling? Has your mood been okay?
Yes.
Okay. So we're going to go ahead and start with checking your skin. I'm looking for any open lesions or sores, the color and the texture. I'm going to go ahead and feel your skin here for temperature. Temperature is warm. There's a macule above the right lip that is a freckle. Other than that, I see no open areas or anything of note. I'm going to go ahead and move on to the hair now. Hair is evenly distributed. There is no inflammation, no lumps or bumps, and no infestation. We're going to move on to check your fingernails, if you don't mind, if you'll hold your hands out for me. And I'm seeing brisk cap refill at 2 seconds. The nails are clean and well groomed. There's no cyanosis. I'm going to go ahead and do your lymph nodes here real quick. You start with your occipital lymph nodes through the back of your head. I'm going to go in front of your ear here to the preauricular lymph nodes, and behind your ear to the post-auricular, and then the anterior cervical lymph node chain, and the posterior cervical lymph node chain, and then we've got the subclavian lymph node chain, and then we're going to check your tonsillar lymph nodes, and your submandibular lymph nodes, and your submental. And while we're at it, if I could have you raise your arm, I'm going to check underneath your arm here for your axillary lymph nodes. And then here in your arm for your brachial lymph nodes. And we'll do that on the other side as well. Okay. And I want to test your 11th cranial nerve, which is the accessory nerve. I'm going to put my hand by your head, and if you'll try to push my hand away. Okay. And the other side. Very good. And then if you will shrug your shoulders for me. Okay. Cranial nerve 11 is intact. We're going to move on to your ears. Have you had any problems with your hearing?
No.
Okay. Ready? Before I go to sticking this in, I'm going to feel in the outer part of your ears for any soreness. Is any of that tender?
No.
Okay. I'm going to kind of feel in here for your mastoid bone. Is that tender or
No.
okay? All right. So I'm going to give a listen here to your ears. I'm going to make sure that I get this good and braced. Pull up your outer ear. Put my luminary in place. Your temporomandibular, oh my goodness, your tympanic membrane is gray and pearly white. There's no redness. And the cone of light in that left ear was at 7 o'clock. I'm going to go to the right side here. Going up the pinna. Bracing. Okay. The tympanic membrane is pearly white there as well, with cone of light at 5. I'm going to go ahead and move on, and that is the vestibulocochlear that we are assessing now, cranial nerve. For your hearing, and this is actually the Weber test. We're going to put this on your forehead, and let me know when you can, or not when you can, let me know if you hear it in both sides equally. And the vestibulocochlear cranial nerve,
Yes.
is a sensory nerve. And it is number 8. Okay, well, before we do that, this next part is the Brennan test, and it's testing bone conduction versus air conduction. So when I put this on your bone, let me know when you can't hear it any longer, and then we'll move it in front of your ear and tell me when you no longer hear it as well.
Yeah. Yeah.
Okay, very good. Air conduction is twice as long as bone conduction.
Yeah.
Oh, I'll do that one again because I doubled it. Okay.
Yeah. Yeah.
Okay, very good. And the last part of the ear test we're going to do is the whisper test. And it's actually testing your hearing. I'm going to include your ear and whisper a phrase and just tell me what I said.
Grandmother.
Okay. Ocean.
Ocean. Bluebird.
Okay. Try that one again.
May 15th.
Okay. That is very good. So we're going to move on to the eyes now. We'll start with the vision test. That is cranial nerve number 2, which is a sensory nerve for vision. There are multiple ways to test your vision. The main one that they usually do in the doctor's office is a Snellen chart, where you stand 20 foot back and it tests your far central vision. Since we don't have that kind of space today, we're using a Rosenbaum chart. And for it, we hold it approximately 14 inches from your face and just read the lowest line that you can.
LTFPH.
Okay. And cover one eye for me.
LTFPH.
And the other eye.
LTFPH.
Okay, very good. So that is 20/20 without correction. Next, we're going to move on to assessing cranial nerves 3, 4, and 6. And those are motor. That is the oculomotor, trochlear, and oculomotor, trochlear, it'll come to me in a minute. Anyway, 3, 4, and 6. So the first one, we're going to shine the light right at the tip of your nose, and I'm going to watch where the light falls in your pupils. And it falls in the same place, equidistant. Okay, and then we're going to do pupillary responses. So I'm going to shine this in your light and watch your pupils dilate. There's the direct dilation, and it did. And direct dilation on that side as well. Now I'm going to check for consensual dilation and see if the other pupil dilates at the same time. Okay. All ready? And we need to check for accommodation. Just watch the tip of the pen and it's going to come in towards your nose. Okay, good accommodation. And then we're going to follow the tip of the pen in the 6 cardinal fields of gaze. And that cranial nerve that I couldn't remember a while ago is the abducens. And it has to do with ocular eye movements, like this lovely cardinal fields of gaze, which is all intact. Okay, and then our next step, we will check the ophthalmoscope vision. Turn on our lovely light here and get it about a 15-degree angle. Find the red right at right reflex. Okay, and come in. Get this where we can brace it well. So we can have it run into you here. Visualizing the optic disc and the blood vessels, and they all look good. Okay, over to the other side here and do the same thing. Okay, well, there's the red light reflex. Okay, and the optic disc and blood vessels all look good. Okay. So our next step here is we're going to look at the nose. Look at the correct apparatus here. Okay. And if you can lean your head back, I'm going to check the turbinates in your nose. Actually, I want to do it this way. There we go. Okay, turbinates are good. Not much drainage there. Okay, and as I'm thinking, out your nose, throat, 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 throat. Put my pen light in my pocket so I can't find it. Okay, so now we're going to check several of your other cranial nerves. So if your cranial nerves 5 and 12, the trigeminal and the glossopharyngeal, not glossopharyngeal, hypoglossal. The hypoglossal, if you'll stick your tongue out for me, and I'm just looking to be sure that the line is midline and not going to one side. Yep, that's very good. And this one here, if you will open your mouth for me and move your jaw side to side. Okay. Joint is good and good strong movement. Just look in your mouth here. If you'll open your mouth and buccal membranes. I don't see any sores. Teeth are intact. No dental problems. Frenulum is intact. You'll say ah for me. Ah. And the uvula moves up with the soft palate, which is the glossopharyngeal cranial nerve, which is number 9. And we're going to go ahead and do your gag reflex, if you'll open your mouth and say, ah, ah. Gotcha. And that is the vagus nerve, number 10. So, uvulus midline. Okay, so we're going to move on because my brain is not coming with me. Go ahead and let's do your fingers here. Just kind of touch one to the next here.
Saxophone sound together.
Okay, very good. If you will close your eyes and touch your nose and with the other finger. Very good, thank you. And I'm going to test the range of motion in your neck. So basically it's put your head down, tilt it back, and then try to touch each shoulder with your ear. Okay, that's good. And I'm going to take your arm here. I'm going to do a little bit of range of motion on your elbow. Just kind of moving it around a little bit. Okay, and your shoulder. Does any of that cause any pain? No. Okay. And can you do the same with your other arm for me? Raise it up above your head. Okay. Alrighty. I think we're down to the point. I'm going to take a break and look at my card, which is, where did I lay it? There it is. So I've got 60 seconds here. Tick, tick. Okay. The thyroid, neck, carotid, is some of the lovely stuff I forgot. Yay. So I'm going to palpate your carotid artery here, one at a time, so that I don't make you pass out. I'm going to listen to those. Heard on that one. On that one. And then I need to check your trachea and your thyroid, which I don't see any thyromegaly. And it appears midline. Feeling it is midline. Swallow for me. Got the thyroid go through my fingers. There are no nodules or issues there. And so we've done all the ears and the eyes. I'm going to get this stuff out of our way. And then I'm going to beat on you a minute and check your deep tendon reflexes. Okay. Start with the brachialis here, or actually we'll start with the radius. Just kind of keep it resting there in your lap, completely relaxed. Okay. Come up here to this one, brachius. Okay. And if you will just kind of just flat relax your arm, just let me hold all the weight. Okay. I'll do the same on this side. Your radial, just kind of relax it in your lap there and turn it out a little bit. Okay. And then your triceps. If I mind again, it's biceps. Okay, and then again, we're going to just rest it there. Okay. And then we'll go to the patellar. And we're going to go to the Achilles, back of the limb. That one. So that's got our tendons taken care of. So if you'll remove your shirt, we're going to go ahead and listen to your lungs, check your heart. Okay. So to start off with, I'm going to inspect the skin. I don't see any sores or open areas. A little bit of striae on the abdomen. Get your back here. And a few freckles. Okay. I'm going to feel for any impulses or heaves.
Oh man, I should have done that earlier.
Belt. Go ahead and listen to your lungs here. Starting up in the upper realm. Deep breath, please. Bronchial sounds are clear. Awesome. Bronchiovesicular sounds and frontal lobes are all clear. If I can get you to raise your arm a little bit, and now listen in your side of your lungs here. Okay. On the other side. Listen to your back here. Okay, very good. Now I'm going to go ahead while I got this lovely stuff in, and I'm going to listen to your heart, starting on in the second right intercostal space to the right of the sternum. That is the aortic. The second left intercostal space. And that is the pulmonic. The third left intercostal space. That's Erb's point. And then the fourth left intercostal space. And that is the tricuspid. And then the fifth intercostal space at the midclavicular margin. Would you lift your breasts up for me? That's the mitral as well as the apex. And I'm going to listen to that for a minute. typical pulse is 76. And I would also listen to it with the bell of the stethoscope, because the bell can often pick up lower pitch sounds. In this case, there were no murmurs or gallops heard. No S3 or S4 was heard. So I'm going to go ahead and check your other pulses here while we're at it. Check your temporal pulse. Strong and equal. And your brachial pulses. Equal. +2. Radial pulses with +2. And the posterior tibial. +2. And the dorsalis pedis. Equal and +2. Have you lay down on the bed here. And when we're listening to the heart, there are 3 stages that we listen to it at. One is standing, one is laying, and the other is laying on your left side. So if I can get you to roll over on your left side. And this is important because it pushes the heart forward in the chest so that it's closer to the chest wall. And we listen in the same 5 places: the aortic, the pulmonic, Erb's point, the tricuspid, and the apex. And then we also feel toward the point of maximal impact. Okay. Alright, well, I've got you here. I'm going to test for CVA tenderness, which is tenderness over your kidneys. So, kidneys are about in that area, so when I kind of punch myself here, let me know if you have any tenderness. Yeah. Yeah. Alright, you can roll back over on your back. Okay, and we're going to go on to the abdominal assessment here. So, inspecting the abdomen, the umbilicus is midline, striae are present. And let's start with listening to the vowel sounds in all 4 quadrants. And we'll listen for 5 minutes to be sure that you have normal vowel sounds. I'm hearing vowel sounds quite readily. They are normal active. Okay. And I'm going to listen for the aortic artery with the back because we're listening for any grooves. Okay. And the renal arteries. Iliac arteries. Okay, no groove is heard. And we're going to do some palpation. We'll start off with light palpation. You know if any of this hurts. Abdomen than a soft and non-tender. Okay, we're going for a little bit of deep palpation. Let me know if any of this hurts.
Will it go? This lovely thing went off at 31.45. If it does, I'll pause it and hit the video again.
And it's expected to sound tympanic, like a drum, over the stomach and intestines, which is what I'm hearing. Okay, and then over the other areas, like spleen, it's expected to be dull, like that. Let's do a little bit over the liver here.